It's of course been a really challenging time, because if a lot of your communication you rely on lip reading and you've then got that covered up, it's going to be really difficult for people just to simply communicate something that you and I would take for granted. So we know obviously on the 19th that legally masks are set to go, but of course, as we know, many people are planning on still wearing them. Transport companies are going to be given their own discretion as to if they want to bring in mask wearing. They're going to be supported. It's going to be guidance, not law. I'm here at the Cambridgeshire Deaf Association with the lovely Dahlia Puce and her interpreter Rachel Dance to discuss some of the concerns really going forward, because people are going to continue wearing them. So where is the end in sight in terms of communication difficulties? So I'm going to take a little step over here and I'm going to speak to you, Dahlia. So tell me a little bit about the difficulties that you've experienced through the pandemic.
Yes, I mean, I think the first lockdown, that was really, really difficult for me, and it was difficult to get through. And I think a lot of deaf people who relied on lip reading, suddenly having the mouths covered up, and people were really resistant to take their masks down. It did make it very, very difficult and very stressful as well. I think maybe at the second lockdown, people were a little bit more deaf aware. So I think a few more people were more accepting and they would take their masks down sometimes. So that did seem a little bit better then.
And how frustrating is it for you when people may not know that you have hearing loss going forward? You know, how do you even communicate that with them when they've got their face covered?
Really, I try and use my phone as much as possible. I might write things down to say, you know, I'm deaf, I rely on lip reading. And some people are really accepting and they say, oh, I'm really sorry. And they'll use, you know, paper and pen, but they might not still remove their mouth. And then other people will be more willing to remove their mask, definitely.
And how useful for you are clear face coverings? Because I know they started to be introduced through the pandemic. Was that a bit of a lifeline for you?
Yes, definitely. I mean, I hope in the future, if we can carry on using masks, that, you know, people are more deaf aware and they are more used to wearing clear masks or even face visors so that we can still lip read. And obviously we rely on that kind of visual nature. Hopefully that will be a lot less stressful for deaf people and will reduce a lot of the barriers. So hopefully that will be better in the future.
So tell me a bit about the different areas that you struggle to communicate in. I would imagine perhaps busy spaces. What are your thoughts on that, and where would you see challenges going forward?
I think the most difficult is in hospital. Access to GPs and things like that are really important. Obviously in some shops as well. Deaf need access everywhere, but I think the hospital really, if you're ill, or the doctors, that's really, really difficult. I've definitely struggled there.
Because under the new guidance, they're going to continue to be used in hospital settings. I mean, that must give you a sense of anxiety, surely.
Yes, I mean, that is right. I am worried as well. And if they are continued to use in hospital settings, hopefully there is a little bit more of awareness to change to clear masks or face shields for deaf clients to have that accessibility. So that's my wish for the future.
And looking towards the future, as you were saying, what do you want people to be aware of in terms of your difficulties, and how would you want people to approach a situation where you might struggle to communicate with them?
So personally, I think maybe a lot of hearing people don't understand the difficulties, and they don't understand the need for it. They might think, we're okay without the clear face masks. But what I would say is, imagine if you couldn't have a voice and you can't hear, what would you do? Or you don't have a voice and people are asking you to speak up, or you're having to ask people to lip read, just to have that empathy and imagine what it would be like to be in those shoes.
Absolutely. I think what a poignant conversation really going forward. People just need to be aware of other people's difficulties. Thank you so much, Dahlia and Rachel. Now I want to bring in Andrew Palmer.
Thank you so much as well. Lovely to see you.
Thank you. So if we take a little step forward, Andrew, we spoke in the last hour. Andrew, by the way, is the Chief Executive of the Cambridgeshire Deaf Association, and he's been telling me about what his concerns are going forward. Andrew, obviously it's going to continue to be a barrier You've got family who are deaf. You said your parents are deaf. What are their concerns?
I think, as Dahlia said, the concerns are in those different settings, especially health and social care. It makes those difficult situations a little bit more difficult. And organisations like the Cambridgeshire Deaf Association and many other charities around the UK are all about trying to remove barriers. But unfortunately, because of the nature of this disease, those barriers are going back up, and it's kind of taken us back a few years. But I think what we really want to do is encourage providers who, in healthcare, the NHS, for example, or public transport, to invest in clear masks and also think about ways that they can serve their deaf customers and patients without the need for a mask, so maybe behind perspex screens, and just show that little bit of flexibility and understanding, because deaf people are UK citizens too, with every right that everybody else has got. We want to make sure that they have the same access to services as everybody else does.
Absolutely. You know, obviously I cover the east of England, and it makes me think back to Addenbrooke's Hospital. They actually created a hospital-grade clear face mask through the pandemic. But personally, I've not really seen a lot of clear face masks being used. What would you want to change about how people communicate with deaf people and people with hearing loss? Just, I suppose, as Dahlia was saying, empathy, really.
Well, I think that's every human's capable of empathy, I think. And so I think in situations where you're communicating with someone with hearing loss or deafness, is just be yourself, rely on your natural kind of body language and your natural expressions. Use what's around, like mobile phones, for example. It's very easy to make notes on there. They can also pick up voice and transcribe. So I guess it's just take a moment, be yourself, don't freeze up. You've got, most of our communication is via facial expressions and body language anyway. So try not to kind of suppress that part of the way you communicate, and then use the tools at hand and it'll be fine. I think just approach it with a positive, open mind, and most people will see their way through.
Thank you, Andrew. Well, it seems that going forward, empathy is what's really going to be needed, because, of course, past the 19th, people are still going to be wearing masks. And so it begs the question, well, where does this difficulty in communication end, Alex and Simon?